You're listening to the UBC Medicine Learning Network.
So when I was diagnosed, my GP actually phones to say, hey, I have your results. I need you to come into the office. And I said, no, just tell me. And he says, well, I really, really would like you to come into the office. And I said, nope, I have to open up in a half hour. And he said, I'm really sorry. You're positive. You're HIV positive. And my response was, slam the phone down, burst into tears. And then it was like, okay, suck it up, buttercup. Now you have to get on with life. And you have a new life that just started.
From UBC Medicine, this is The Listen. Stories of virtual care in context. I am your host, Dr. Kiran Veerapan. Today, providing patient support. No one is ready to hear the news that they've contracted a life-threatening disease. For our patient Darren, his diagnosis of HIV led to fear, alienation, and secrecy. Today, Darren shares his lonely journey to finding patient support.
At that point in time, to have an HIV diagnosis was a death sentence. Lots of people got the news and went out a window. That's how they dealt with it. That's what the support mechanism was. You were a pariah on the nightly news. Families disowned you. You could lose your job. You could lose your mortgage. You could lose your rental. And there was really no support mechanism in place. So then you're trying to figure out, who do you talk to? Who can you tell that will actually maybe keep their mouth shut? So that was this big secret kept for almost a decade. I didn't engage within the HIV community until 1996, I guess it would have been, when I first stepped through a door of an agency to get support. And in doing so, just breaking to tears at the desk of the receptionist. And they just leaned over, put their hand on mine and said, you're home. And that weight, that it was finally amongst people who weren't going to judge for having disease. And so that was all part of that bigger equation of patient support.
The way you treat a patient leaves a lasting impact on their healthcare journey. For Heather, the lack of patient support for their non-visible disability led to feelings of frustration, being judged, and a lack of trust in the healthcare system.
Yeah, so at 17, the pivotal moment for me was at a 4-year-old's birthday party where we went bowling. As I released the ball, I had a real bad pain in my wrist and went to the hospital. And 6 months later, this pain had spread throughout my body to the point where I had had to quit school, work, driving, writing, sports. And I was desperately looking for something that would fix me, that would, figure out what to do about the pain so that I could reverse it and go back to the life that I was living. It took 6 years to find a diagnosis. But a big part of it also was that it was hard to find a holistic approach to medicine because I would be sent to one doctor for my migraines.
Sorry, I don't see anything in your blood work.
One doctor for my wrist pain.
You should probably see another specialist.
One doctor for my knee pain.
I'm sorry, I just can't help you today.
And they didn't communicate because my disability didn't show up in the blood work. On the scans, they found it harder to believe. Even when there were answers, those answers weren't shared with people, and that felt really frustrating too. So I felt infantilized by the system. And then when they couldn't solve my problem, I felt very gaslit and also judged because they would rather see me as a problem than that they couldn't help me. It felt like I couldn't win because, I'd go in and I'd be crying. My whole life had been taken from me. There were already judgments made before I even got into the room. This was especially frustrating when we'd wait 7 months for the appointment, 2 hours in the waiting room, and then they gave us 5 minutes. And I had doctors who opened the file, took a brief look, said, I can't help you, and would walk out. it felt like there was no humanity there. And there were some good doctors who would say, like, I can't help you. This isn't my sort of expertise. And I appreciated them saying that, like, just that honesty was really important. And it wasn't until I found a rheumatologist who looked at my entire medical history, I was able to find somebody who took me seriously, put all the pieces of the puzzle together, and was able to give me the answers that I was looking for and gave me some methods that I could use to help control the pain.
Poor interactions not only stifle the patient's ability to create supportive relationships with their healthcare providers, but also lead to poor health outcomes. Dr. Maria Hubinette, a community-based family physician and clinical professor at the UBC Department of Family Practice, shares with us how using novel approaches to patient care builds trust and supports stronger patient partnerships.
People often come and see us who have had a bad experience with the system or who have somehow fallen through the cracks. These folks are vulnerable because the system doesn't work for them. So it's not an issue with the people, it's an issue with the system. And so thinking about, there's another human sitting in front of me that is in need of support in some way or is having trouble with something that requires us to collaborate on finding some novel approach to this if other things haven't worked. If that means bringing my dog because I know they're excited to see the dog, and if that's the motivation for them to come and get care, like that's easy to do. Like I love bringing my dog with me anyway, like that's no extra work for me. I think traditionally our system thinks of people as, they're not compliant or they're not following up like they're supposed to follow up, or they're not able to make any of their appointments, or they're going against medical advice. And if we flip that and say the system's not meeting their needs, so how can we do that better and take ownership of our own sphere of influence and make those small changes and those small differences in the care that we're providing in that moment on that day.
While virtual care can be more accessible and beneficial care option for many, it can be challenging for some. Darren shares Dr. Hubinette's perspective that compassion for your patients can bridge gaps whether care is virtual or in person.
And I think of my mom, who's no longer with us, during COVID, trying to have her doctor have a call with my mom and then have my sister on that call and making sure it's a conference call. And what a nightmare that was, because mom would only remember certain parts of the conversation. And then she wouldn't remember that there was a drug being prescribed, that there was a appointment needing to happen with the lab. Like that part was hellish. And, mom had early dementia. And so trying to get that through to the doctors and the receptionists, like mom can't come see you by herself. She has to have somebody with her that's taking notes. Otherwise, this is all going to go to hell in a handbasket real quick. And that was really difficult. And virtual care wasn't there for that part of it. Like that's where virtual care fails. So hopefully that our healthcare systems will be much more compassionate. And I guess in that bigger piece, HIV brought a change to the system about people at bedside at 8 o'clock when the chime would go, visiting hours are now over. Please make your way to the exit. We will see you again tomorrow at 9 a.m. HIV said, screw that. We're not going to allow our loved ones to die without somebody being here. They can't die alone. That changed the system. That changed how care happened. These were not pariahs. These were human beings. And in their last moment of life, deserved compassion. That's a system change.
Virtual care allows patients with disabilities to meet their health professionals in a comfortable and safe environment without the challenge of travel. At the same time, these appointments can be very daunting for those with complex and chronic conditions. Heather shares some ideas on how healthcare providers can better prepare their patients for virtual appointments.
Like for myself, my GP's in Maple Ridge and I'm in Vancouver. So having online access is great because I don't have to spend 45 minutes getting out to her office, especially for things like where it's just getting refill, right? Which I go in the office, they fill out the form, I go back and it's taken me an hour and a half to get there and get back. So I think virtual care really has to think about having discussions about how best to have appointments, because you're not told how to be disabled, right? You just kind of dropped into this world. Is there anything that the person could do prior to the appointment? Or is there any particular information they need? Like being prepared is big. So sometimes you'll wait for an appointment and then the doctor's like, oh, well, I can't talk to you unless you have X, like this x-ray or this blood panel or something like that. And then the appointment just ends. So how do you have communication on both sides to make sure that the appointment is being used, productively? Or expectations of what to ask. Like, it's interesting. A lot of medical professionals are now saying, like, you can only talk to them about 2 things in an appointment because they only have so much time. But the problem is for people with chronic complex conditions is that there's like 10 things that are going on, but they're all connected. So how do you divide out of that, right? And so I think that's a big thing is people aren't sure how to have conversations on virtual care or in-person care about how to pick parts of the overall issue, especially as non-medical people who are just trying to, figure this out on their own. And also things like, you could drive for an hour to your doctor's appointment and it gets canceled. And the level of frustration you have when that sort of thing happens is huge. Whereas if it's online, it's a lot easier to kind of continue with your day. And then also just are there ways to communicate beyond that virtual care? So if, the doctor was in a rush and had to get to the next patient and quickly shut it down, are there ways that the person can access the doctor through the office, say, and ask that follow-up question? And I think that's where support groups are really helpful, people who've already gone through it and who've kind of learned things like making sure you get copies of your records and reading that beforehand, having an idea of kind of a feel for what the doctor was focused on, and support people, whether it's financial accessibility, geographical accessibility, computer literacy. It's all about accessibility, right? It's all about options. And I think that's a big thing too, is offering people options. So not saying that it's either virtual care or in-person care, but that you can have both.
As a health provider, the trust you build with your patient hangs in the balance of every decision you make. How you connect, the care options you provide, who you refer them to, and the questions you ask all play a role in building this patient's partnership. Dr. Hubinette leaves us with her thoughts on how honesty, listening, and humility are the foundations to supporting your patients.
We don't know who sitting in front of us or who at the other end of the phone or who on the other end of a video call might have experienced trauma or could be currently experiencing trauma. And so if we think about in that situation in terms of creating safety or trustworthiness, like if you say you're going to do something, do it. Don't make empty promises. And so thinking about ourselves and our patients as partners in their care, if we can also appreciate that the expertise of somebody with lived or living experience that they bring, we can then, bring in those different types of expertise together. And if we think of referrals or of connecting our patients to other resources, sort of as expanding the circle of care, expanding the team in some way, I pick those team members carefully because it's important to maintain that trust. And my patient is trusting that I'm adding team members in their best interest. And so with experience over time, I know who those people are and I choose them because I know that they'll treat my patient with kindness, with respect, will attend to their particular needs in a way that makes them feel like a unique individual. We do people a huge disservice if we don't appreciate the diversity of where people are at with these different things, and certainly with respect to the resources that people have, be they financial, cognitive, physical, emotional, whatever, and having some humility to appreciate that we can be wrong and we can not know. And, the only way to then find out is to ask people, what do you need? What would make a difference for you?
As healthcare professionals, we intend to provide quality patient support every day. However, a one-size-fits-all approach to patient support leaves patients isolated, disengaged, and lacking trust. Each patient is unique, with their own set of challenges, and we must learn how they feel best supported. This approach will put you on the path of building lasting trust and a strong bond between you and your patients. I am Dr. Kiran Birupin. This has been The Listen.
This has been a presentation of the UBC Medicine Learning Network.